And welcome back. I'm Mabel Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. Thanks for joining us. And my next guest works with coalitions to provide benefits packages at good value. Welcome to you, Mick Rodgers. Thank you so much for your time.
Thanks.
And you're the principal and managing partner of Axial Benefits Group. And you work with coalitions. Tell me about those and the benefits of coalitions to work with you.
Great. So, essentially I think what we've done is we've figured out how to aggregate risk, right? Which I think everyone really, intuitively understands how to, that when you buy in bulk, when you buy more, you get deeper discounts. So I think, again, that's why most folks shop at Costco or Walmart's, because they're able to access that type of bulk buy. Well, what we figured out how to do is take that same type of bulk buy and bring it into the health insurance world for small and mid-sized groups, so that they buy independent programs, but they are all measured as one. So the thing about healthcare that's a little bit unique with the bulk buy is that even though you get that bulk discount as you get larger, you also get stability and predictability that comes with that size. Essentially, I think the other thing that folks intuitively understand is that the largest companies in the United States buy their health care different from the small and mid-sized companies. And what we've been able to do is learn from that and aggregate a lot of small and mid-sized companies to get to that larger size buy, access to the market, and then do that. The last thing that's really, I think, sort of cool about our coalitions is that, we create these pools of our clients of about 10,000 employees. They pay premium to the pool, and the pool covers their claims with some reinsurance, et cetera. But if that pool is unspent at the end of the year, they can receive that premium back. So last year we were able to give back $3.5 million.
Wow. Okay. Tell me specifically about the program or benefit that they're buying in bulk.
Yeah, so there really isn't one set program, right? So if there's 30 companies in a coalition, there conceivably could be 30 different programs, 30 different benefit styles, different carriers, different program levels, et cetera. Because essentially what we're doing is on the back end of the purchase, so the front end where the employees touch, we're not really affecting. So we have an expression in the practice. It's not really what you buy, it's how you buy it. And because we're able to aggregate it, we're able to value each client's benefit level so that it's not a consistent cost for everyone. Everyone could be paying different levels. It's just what they're buying. And
if you have more members, more participants in the coalition, does the price come down further? Oh, absolutely. Yeah. Okay. It comes down, one, because we're accessing the insurance purchase market at a higher level where the Fortune 100 companies are doing it, but also the way that we're giving back the premium at the end of the year if it's unused. They get to sort of lower that cost and receive that benefit coming back. Is there a fee to join the coalition? No fee. We limit it to our clients or some strategic partners across the country that can give them access to it. But there's no joining fee, et cetera, nothing like that. And how do they participate? How do they get into this? So we're trying to get our message out, right? I think that one of the things that we've figured out how to do is aggregate these groups together, and we've proven it on a large scale. So now we're really trying to get out there throughout the country and get the message out. I think if you looked at our business model 5 years ago, you could draw a 50-mile radius around Boston, and that's where all our clients are. And now in 5 years, we literally have clients in every state. The message is really ripping through the country. Okay, and who are some examples of who these people are, of these companies are in the coalition?
Any company with maybe between 50 employees and 1,000 employees are eligible to join.
Okay. What are some of the longer term trends that you're very encouraged by? We're talking a lot about data and knowing more information than ever before so that we can price things better. What else do you think is really cool that's happening?
I'm smiling because data is my thing. I'm a former engineer and I'm a data geek. We have an expression, the math doesn't lie, right? So we're able to, now that we've matured these blocks of business, so that we've been able to really dig in and analyze what's going on in the groups themselves and able to deploy cost controls on a specific level. One group may need a certain type of cost control that the other 28 don't need. So we're able to sort of deploy it and lower healthcare costs for each one depending on what we see in the data.
Okay.
Our average cost per employee per year is about 40% lower than the national averages. So I think what we're doing is really working.
Right. But what about price disparities? We hear a lot about a certain procedure costing this much someplace and then 50 times more someplace else. Are you able to reduce that risk with your coalitions and the strategy that you have?
100%, because we've built into the coalitions these navigators or independent nurse case managers in the vein of concierge services, so that the concierge service is able to work with patient members and get them to go to the facilities that have the highest quality and the lowest cost. And because they are coming at it from a concierge level, they're able to actually help schedule the appointment and work around their geographic restrictions. And I think that the process has really been going. This will be the third year that we've implemented this process, and we see better and better results each year.
Okay. This is your first time at the Congress.
It is.
How are you finding it so far?
There's a lot of energy right now. I know we're early in the conference, and I've seen the agenda, and I'm excited about, I think, some of the sessions that I'll see. But more importantly, I think it's encouraging to see how many people are actually here and that want to learn more.
All right. Mick Rodgers, thank you so much for your time today.
Appreciate it. Thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned. Much more content to come.